From the PEP Radio Newsroom, this is the Hourly News Blast. LGBTQ Nation is reporting the Senate Appropriations Committee on Thursday rejected the presidential administration's proposed termination of the CDC's HIV prevention and surveillance efforts, as well as massive proposed funding cuts to the National Institutes of Health, advancing a measure that would increase the agency's budget by $400 million. The White House budget called for slashing NIH funding by $18 billion, a decrease of 40%. The committee rejected those cuts and others addressing HIV prevention, treatment, and care, advancing the bill with overwhelming bipartisan support on a 26-3 vote. This committee has had multiple hearings over the last several months and heard from patients, families, and researchers about the importance of NIH funding, said out Senator Tammy Baldwin, the Democrat from Wisconsin, in remarks after the vote, The Hill reported. This committee has, in a bipartisan manner, prioritized NIH and the research it supports to develop life-saving treatments and cures for devastating diseases. Earlier this month, both the House and Senate Appropriations Committees rejected the presidential administration's proposal to eliminate the Department of Housing and Urban Development's Housing Opportunities for Persons with AIDS program. While the House proposed maintaining the current $505 million budget, the Senate proposed to increase it by $24 million. The committee also rejected funding cuts and block grants to states for prevention efforts focused on hepatitis and other STIs. Senate appropriators preserved those parts of the administration's budget that had maintained funding addressing HIV and PrEP programs, including $542 million for the Ending the HIV Epidemic initiative launched by the president in his first term. The initiative's funding includes PrEP in community health centers and enhanced HIV prevention and treatment programs. Most of the Ryan White HIV/AIDS program was preserved as well. The committee also rejected the administration's plan to revamp the way the NIH pays universities, medical schools, and other research centers. The president has invoked executive orders against gender ideology, child mutilation, and DEI, along with accusations of anti-Jewish behavior and threats of withholding NIH funding in his crusade against universities, their associated medical schools, and other research centers. To the scientists wondering if there will even be an NIH by the end of this administration, the committee's resounding message is yes, said Senator Patty Murray, the Democrat from Washington, the committee's vice chair. Congress has your back. We're not going to give up the fight against cancer, Alzheimer's, or rare diseases, Murray said. Carl Schmidt, executive director of the HIV plus Hepatitis Policy Institute, was cautiously optimistic following the committee's bipartisan rebuke of the president's funding priorities. We are pleased that senators of both parties recognize the critical importance of preventing HIV in the United States and the value of nationwide surveillance, testing, education, and PrEP programs, he said in a statement. The president's proposed elimination of HIV prevention and surveillance programs, along with on and off staff and grant cuts and delays, have left HIV prevention in disarray. We hope the Senate's vote of confidence for HIV prevention will start to bring the stability we need so that state and local health departments, other grantees, and staff can get back to doing their work. That's News Blast for this hour. Coming up at noon today, we have a full hour in memory of the late Tom Lehrer, with songs such as The Masochism Tango and Poisoning Pigeons in the Park. Join us in the Smokers Lounge at noon. Up next, we have the Meadville area weather forecast here on PEP Radio.